Hi, welcome to the first edition of Your Health with Dr. Christy. My name is Dr. Christy Risinger. I'm an internal medicine physician practicing in Austin, Texas. I've been practicing for 15 years. I feel passionate about starting this channel because I never seem to have enough time with my patients, and these are some of the things that I would like to tell my patients but just don't have enough time. I'm hoping that this will be a source of information. I do need to have a disclaimer and let y'all know that these are my professional opinions. Of course, I'm not gonna know every single detail about every single item, but I'm sure gonna try to give you guys some straightforward guidance, mostly about preventative medicine. And I'm so glad you're here. My first issue that I'd like to bring up today is the question that I often hear from patients is, should I get a colonoscopy? Well, and my answer to that is maybe. I'd like to talk with you a little bit about colonoscopies and colon cancer screening. It's not the most glamorous topic, of course, but it's one that's really important. Colon cancer is one of the leading causes of cancer deaths in the United States. It's just heartbreaking for me to hear patients that have been diagnosed with colon cancer, knowing that those polyps that are the start of colon cancer have been growing about 10 years by the time they become cancer. Most colon cancers arise from something called adenomatous colon polyps, or those polyps that you hear people talk about in the colon. Those polyps then turn into something called dysplasia, and then they eventually turn into colon cancer, and that process takes about 10 years. So even though they're slow growing, they still can lead to some very, very deadly consequences, but we can catch it early, and it can be completely treatable and preventable with the right steps. Adenomatous polyps are found in 30% of men and 20% of women. And they look exactly alike when you see them on a colonoscopy or on a virtual colonoscopy. And so they really need to be biopsied for us to know whether they're precancerous polyps or just benign polyps. Like I said, the progression from adenoma to cancer takes about 10 years. So we've got a lot of time, but it needs to be found early enough to be completely treated. I personally recommend that anyone over the age of 50 or older, men and women, get a colonoscopy, and that they continue that colon cancer screening until the age of 75. We can continue it later than that if the person's healthy. A good gauge is if you think that person's going to live 10 more years, then I encourage them to get a colonoscopy. But one of the important questions to answer is, if we find colon cancer, would that person want to be treated for colon cancer? Because if they say absolutely not, then why go through a colonoscopy? So it is important to have a discussion with your primary care physician about colon cancer screening at the end of your life, like over the age of 75. There are lots of people that are so healthy, I absolutely recommend it, but there are some that, I wouldn't recommend it because it's just, colonoscopies have some risks associated with them, and if they're not going to live long enough or have the desire to go through colon cancer treatment, what's the point? I just want to spare them that difficulty. Like I said, the gold standard to find colon cancer is a colonoscopy. The pros for a colonoscopy are that it's, like I said, the gold standard. If your colonoscopy is normal, you don't have to have another one for 10 more years. How great is that? The prep, of course, can be a little bit uncomfortable, and for most people that's the thing that they fear the most. But as someone who has personally had a colonoscopy, the preps, there are various types of preps, and you can spend more money or less money, and the type of prep really is up to you. Some of them have more volume associated with them, and I personally wanted to use one that had less volume, but that costs a little bit more. But that's up to you. Once you get to the center, they'll put an IV in, they'll give you some light sedation. You'll need to have a ride home, but you really don't remember much about anything from the procedure. The person that takes you to the colonoscopy, they need to be able to receive the information from the gastroenterologist, because they'll be giving important information about what they found in the colonoscopy. And most of the time they have a good idea about when you might need to have another colonoscopy again. Sometimes people need a colonoscopy 1 year later if they found something concerning. Sometimes it's 3 years, sometimes it's 5 years, and some people get a clean bill of health and they don't need to have another colonoscopy for 10 more years. That's great news. There are other things that we can do to screen for colon cancer. Another thing is called a sigmoidoscopy. I don't encourage my patients to get that. It's not, it is similar to a colonoscopy, although you don't need to have the sedation because you don't go as far into the colon. But because you don't go as far into the colon, you don't get a complete look into the colon. So I just figure if you're going to do the prep and go through all that, just get a colonoscopy. You won't remember it anyway. With a sigmoidoscopy, you'll remember it. It's a little bit more uncomfortable. Another thing that people consider and ask me about is a virtual colonoscopy. Once again, if there's anything that's abnormal on the virtual colonoscopy, you're going to need to get a colonoscopy. So I just think just go forward with the colonoscopy. The great thing about a colonoscopy is if they see something, they'll be able to remove it and we'll be able to get a biopsy and we'll know for certain if it's something that we need to worry about or not. Other things that are non-invasive, when patients say, I'm absolutely not getting a colonoscopy, then I still talk to them about some other non-invasive tests, and they're stool-based tests or poop-based tests. One of them is the FOBT, or fecal occult blood test, or guaiac cards is what I call them. I give patients 3 cards. They take them home, they put stool samples on the cards, and then they return them. There are some guidelines about not eating red meat and not taking aspirin to reduce the risk of bleeding that isn't associated with colon cancer. I find most patients hate it. They don't like the dietary restrictions. So if the dietary restrictions are really difficult for you, then just don't do the dietary restrictions, but still return the cards. But if the cards are abnormal, meaning that if we see occult blood, if it's a positive result, even on 1 out of the 3 cards, the recommendation is a colonoscopy. So you see where this all leads, right? The end result is if anything abnormal is ever seen on any other type of screening, then we recommend a colonoscopy, which is why a colonoscopy really is the gold standard. Some other stool-based tests are the FIT test or the FIT DNA test. You might hear something about a Cologuard test. These are great tests. They're non-invasive. It's 1 stool sample. If it's negative, you can go 3 more years. Not all insurances cover it. They can be expensive. Medicare has been covering them, I've found, but you usually have to call the insurance company and get it through the insurance company. So that's something to consider. But if you're a hard no on a colonoscopy, the FIT DNA or Cologuard test may be a good fit for you, no pun intended. And there's no dietary restrictions with that. You can just eat a normal diet. It's 1 stool sample. You send it in to the lab or to your office or to whoever gave it to you, and they'll analyze it. There is some push to initiate earlier screening for colon cancer before age 50. There haven't been great guidelines on that yet. We're still waiting to see how that's going to turn out. So at this point, anyone 50 and older we recommend. However, African Americans, especially male African Americans, I would recommend screening at 45 and not waiting until age 50. But it's hard to talk people into that. Also, if you've had a family history of colon cancer or colon polyps, I would recommend talking to your doctor about getting a colonoscopy or colon cancer screening, doing that earlier. Some signs for colon cancer, things that you should be looking for, because we have seen colon cancer earlier in patients these days, and we're not really sure why. It could be the additives in our food, the processed food that we're eating, just the poor diet that Americans have in general. But some signs to look for that are worrisome are change in your bowels. Let's say all of a sudden you're constipated, or all of a sudden you switch from constipation to diarrhea or back to constipation. That's not normal. Or if your stools suddenly become really thin, pencil-like, that's not normal either. or if you have unnecessary weight loss, or you're losing weight and you're not trying to lose weight, that's not normal. Also, your doctor often will do blood tests, something like a CBC, and if they find anemia or a low blood count, that oftentimes triggers evaluation for colon cancer. Thank you for joining me on my inaugural episode of Your Health with Dr. Christy. I'll continue to talk about other topics that I'm interested in and that I'd like to share with you along the way. Thanks so much.